The vagus nerve is all the craze right now. You know, any search on Google is going to generate millions of hits with life and really health hacks galore. And with all the research, biohacking, and natural science that has been reported lately, it's cool to hear of part of our brain that can have such an amazing impact on our health. But did you also know that the vagus nerve is very important for our kids' development, especially their gut and their immune systems? Now, the vagus nerve can be really the root cause for many kids who are struggling with stomach pain, constipation, diarrhea, constant colds or rashes from viruses or bacteria. Now, we're going to dive into that. Now, my name is Dr. Eric. I'm one of the chiropractors here at Adeo Chiropractic in the Middleton and Madison and surrounding areas. We focus on pediatrics, prenatal, and whole family wellness here in this office. Now, this video can reach really two types of moms. Moms either on the side of holistic side of things who have really tried the supplements, the oils, etc., to really help the gut and the immune system in the past. Most likely the ones who have really Googled vagus nerve before. And then the second one are the moms who are less holistic and just trying to get off of or avoid medications for their kids and have never heard of the vagus nerve before. In this video, we want to address how you can really help know if the vagus nerve is the root cause of your child's digestive and immune struggles. First, we dig into exactly what the vagus nerve is and how does then that look at, and then looking at a test help measure that vagus nerve function. And then both understanding and measuring how the vagus nerve is working to get them the care that they need. Now, before I get into the science, please share this with other moms and parents who you know need to hear this message. Again, we are on a mission to change the trajectory that our kids and families are on currently. Now, into the science. What is the vagus nerve? The vagus nerve has been really nicknamed the wandering nerve because it actually originates from the brainstem and then travels down the cervical spine and spreads throughout much of our upper body, and it's long been known to really control vitally the heart, the lungs, the digestive functions, but we now know that the vagus nerve does even more important work. Recent research on the vagus nerve actually shows that it's crucial in helping regulate our immune system, especially in really lowering inflammation. Because of the immune system's intrinsic relationship with our gut and digestive processes, it's no surprise that these two systems, the gut and the immune system, continue to be lumped together when kids struggle in a cycle of sickness or common digestive disorders. Now, how can I measure its function with my kids, you might be wondering? The first step you must take is to address how your child's vagus nerve is functioning, is to measure it. The most important exam for this is an HRV scan, heart rate variability. Our office is trained and equipped to run an HRV exam on children as young as a few days old, all the way up into us stressed out, worn out parents. And depending on age, HRV is a simple test that takes just 1 to 5 minutes to run, but gives us valuable information about how the vagus nerve works and whether subluxation and dysautonomia are present. And here I have 2 examples of different vagus nerve dysfunction, what that vagus nerve dysfunction would look like on an HRV test. This first one is an HRV of a busy mom who's crazy fit and in great shape. She looks healthy and strong on the outside, but struggles with fatigue, gut and immune issues, and sciatica. What is this sympathetic dominant shows is that her vagus nerve, her brake pedal, is not doing its job. When that side of the system becomes dysfunctional or subluxated, that we talk about, an overactive and sustained sympathetic fight and flight gas pedal of the side of the nervous system response is the result. And you can see how far that shifted it. Now, this one is the scan of just a 2-year-old little girl. This patient struggled with vagus nerve challenges because her sleep, digestion, constant ear infections, gross motor control struggled significantly, and having such a severe multi-system health challenges makes perfect sense with this HRV. You can see how low, where that white circle dot being so low and showing an autonomic activity index of just really 54.89 means that her autonomic nervous system was indeed exhausted and running on low battery. Now, measuring it in this first step puts all the healing in motion for you and for your child. Getting the answers that only the HRV and other neurological scans that we do here in our office can provide. Now, to close this video, first, please ask any questions or leave a comment below or send us a direct message. Second, please share this video with other parents, family, Facebook groups who you know need to hear this message. Third, if you suspect that you or your child is struggling with vagus nerve dysfunction or anything else that we talked through above, going through our clinical process will be super helpful for your family. Not only will it get the neurological scans run to find the exact level of dysfunction within the nervous system, but you'll be able to have an in-depth consultation and conversation with us on your specific challenges. From there, we're going to create a personalized, customized care plan just for you or your child to ensure activation and stimulation of the vagus nerve front and center. If you want to really dig in more, I'm going to attach in the caption 2 additional articles that really dive deeper into the vagus nerve and link to so much more for pediatric and family health. We are always here for you and for your family.